morning. We are here at the 21st International Workshop on Neonatology and Pediatrics in Cagliari, and I am delighted to be joined by Professor Agosti, President of the Italian Society of Neonatology. And I want to ask him, could you summarize briefly the core message of your talk?
Sure, thanks. We discussed just before about the possibility of prevention for the babies for a very severe infection, that is infection by Respiratory Syncytial Virus. That is the virus that causes the bronchiolitis, a very severe infection in the lower respiratory tract in the baby. We have now the possibility to prevent it using monoclonal antibodies in the baby at birth, after just 2-3 days, or after some months in the babies that are born not in the season in which the respiratory virus is turning. And so we began in the last season with this kind of prevention in all the Italy, in all the babies, and we found a very decrease of this kind of disease because monoclonal antibody is very efficacy and very safety, no important side effects, and very good results. The year before, the season in which you use nirsevimab, in many countries, European and also extra-European, France, Spain, Luxembourg, Germany, and the US, Canada as well, they use 1 year before us the monoclonal antibody, and they use as well efficacy and safety of it. And so we have a very good new era for the babies about that.
Professor, what are the next steps of your research?
The next steps are to do a great alliance with parents in order to accept this kind of prevention. We had a very good results for the covered rate in the previous year. Parents approved this kind of prevention, and an alliance also with industry to perform other kind of prevention. We before this moment, this period, we didn't have the possibility to prevent respiratory viral infection for bronchiolitis. Now we live a new era in which it's possible to do that. We have to continue in this line.
Thank you very much for your time and for sharing your findings.
Thank you too.